So here we have this presentation that I called what is the NBDHE and what you can do to pass. So this is about StudentRDH. I am not here to sell you StudentRDH at all. I'm just here to really give you some of the things that I learned by helping thousands of students pass the board examination every year. So I'm going to let you go through the website on your own. You can find some discount codes as well because of COVID. I just want to tell you a little bit more about myself. So this is me. And what I'm doing here, as you can see, this is a deck of cards. So this is a demonstration, this is a competition, and I do memory competition. That's my type of competition. I don't play sports, but this is what I do. So what we do is we put, well, I put double earplugs. I have like foam earplugs, and then I have this industrial grade earmuff over here, and I'm memorizing as many decks as possible, as fast as possible, and then you'll be able to recall them, you know, let's say 7 of queen to, you know, jack of hearts. So all of those, you know, as many hundreds of cards as possible. So what I'm trying to say here is that by me doing this practice of memory for a very long time, and also by being a memory champion, and also by actually coaching, being in the education space for a long time, there's some things that I understood about the brain that helps me also put it together for StudentRDH. So when we are talking about some things in StudentRDH, you might see me talking about the brain a lot, because it's not just the boards that we are trying to pass, it is actually in a way training your brain to be a best performer, whether it is the board examination, the school examination, the clinical examination, or anything you do in life, also patient care. How do you look confident? How you can create a success story in your head already. So I just want to tell you that I'm super passionate about it. So if you are reading some of the things that I have at StudentRDH as a free resource, some of the podcasts that I have as an interviewee, you might again see that I talk a lot about the brain. And if you have questions about that, I'm all for it. I love just dissecting the brain and talk about the different parts that work when you hear music and things like that. And this is the forgetting curve. So this was discovered back about 100 years ago and more. And what I'm just showing you here is that, you remember, see here at the very beginning, when you're learning something, you are at 100%. And after one day, do you see how you are getting to 50% already? That's not what you want, right? And after 1 week, what happens? You are at 10%. So I don't know if you ever felt like that when you go back to your examination the following week. You say, did I even learn that? Did Professor Vogelin mention that? I feel like she didn't, but she did. So because our brain is designed this way for it to forget, so you can actually put more information. But obviously when you're studying for the NBDHE, we are trying to prevent this so you don't have the hole in the brain. So I'm going to talk a little bit about memory techniques over here today in our presentation. Although today I'm going to focus really on the big picture of the NBDHE. It's like, you know, dissecting and strategizing for the bid examination. So I'm just showing you this because if you have StudentRDH or if you're thinking about it, I'm going to talk more about things like that so you can maximize your performance using science. Now, those are the things we're going to cover today. What is the NBDHE? What is the exam format? Do you have tips for me, Claire? What does the day of the exam look like? And things that you might not know. And then just in case you fail, that you will not fail, but just in case, you know, it's nice to have peace of mind. And then I'm going to do a giveaway. It won't be an instrument. You know, this time let's just do a gift card giveaway as well during the webinar. So there's only about 12 of you. It's awesome. One of you will win an Amazon gift card. I think Amazon is the best way to go right now. So what is the NBDHE to begin with? Well, it stands for National Board Dental Hygiene Examination. It is AKA the national. It is that one exam you have to pass in order to become an RDH. However, there's also, well, the regional exam too. But the national board is for everybody living in the United States. That probably is the last examination you're gonna take unless you leave the regional examination for last. If someone asks me, what should I do first, the national or the regional? I always ask them to do the regional first if possible, and then the national, just because the regional is a smaller examination. So it's just a good little practice before you go to the big examination. So Professor Vogel, at this, Voline, sorry, at the school, do you have a specific sequence you are asking the students to take their examination?
They have to do the national written first. Their regional, the credits exam is not until the end of May.
Okay, and the credits, when you say, are you talking about the clinical examination?
Right, right.
Okay, perfect. So thank you for clarifying that. So what I meant for regional is if there's a written portion. So I'm not talking about.
No, Wisconsin doesn't require a written portion to the practical.
Awesome, awesome. So you guys do credits. Perfect. Thank you for clarifying that. So I'm just going to talk about, well, what happens when you take the examination. At the end, you get your results, right? It is about 3 to 4 weeks after the exam that they're supposed to tell you online, okay? They don't give you a piece of paper anymore. They don't give you a mail anymore. You'll have to online log in, like you registered, and it will say pass or fail over there. Okay, so that's how it's going to work. However, students who have been with us, they're just reporting to us that it took them about 2 weeks to get their results. So not the 3 to 4 weeks that they're telling you, just a little earlier than that. And the pass rate is 75. However, a big keyword here, and you probably have heard about it, is the word adjusted. Have you ever heard, you can put yes or no in the chat right now. I just want to see what you have heard about the examination so far. So, you know, this like curved or adjusted, if you ever heard that word, you can say yes or no.
I don't know that I've said a whole lot to them about that.
Oh, okay. Awesome. So let me clarify this. So I don't know if the school examination worked that way too, but when they say 75% and above, that doesn't exactly mean 75 question or exactly 75%. So what happens is, let me just give you a visual of that. If you have like 350 question, there's a portion of them, there's a very small percentage of them are like, they are like test questions that are just there as a cameo, so you don't know they're testing questions that they are trying to just evaluate, and those are kind of fake questions. Okay, you don't know if you're going to be if you don't know, they don't color it in red or anything like that, that tells you, well, this is not going to count toward your examination. So even though you have 355 questions, you might have, for example, 10 questions that were those fake questions. So that's why 75 is not exactly the 75%. Now, the problem is that we don't know which questions are part of those 10 questions that are not going to count. So if you had it incorrect, well, that's okay. That's not going to do anything, you know, that's not going to harm you. If you had it correct, you know, that's not going to harm you either. But at the end of the day, you are going to be graded on 340 questions. So that's why students ask me all the time, what does this adjusted mean? What does that mean to be scaled? Is because of this. Now, another reason why it is scaled is because after that, they look at all the questions and say, everybody got this wrong. This must have been a bad question. So they throw it out sometimes, right? So, you know, because of that, maybe that 340 turns into a 330 question. So it's hard for me, you know, as even someone who specializes in the board examination to tell the students, well, you absolutely need, let's say, 280 questions correct, because there are some variables over here. Okay, so when you are taking a mock examination, whether it's StudentRDH or something else, you know, just to be on the safer side, 75 is the real minimum that you need to achieve. Really, we should be shooting for something like 80, just so we have a little bit of cushion in your heart for yourself of confidence, just in case, you know, they take out some questions or some things that you've done really well were part of those fake questions. Does that make any sense here? Any questions? You can put it over here. I'm here to answer anything you have today. Okay, and you can always come back to that later too, okay? So everything is about pass or fail. Now, if you pass, they don't tell you anything about it other than pass. Straight, celebrate it, and get some ice cream, watch some Netflix. That's about it. But if you fail, they're going to give you a report. The report gives you a little bit of an idea. I'm just going to draw it here if that's okay. So let's say oral pathology. It's going to give you something like that. This is your performance over here. while everybody else, the national average was something like this. So it just gives you a general idea per topic how you've been performing. They don't tell you you missed 3 questions out of 10 or something like that. It just gives you just some sort of bar chart. It changed recently. In my mind, this does not give you enough information because again, you don't even know how many questions there were on orthopathology. But at least you can tell yourself, okay, my weakness was orthopathology, pharmacology, maybe case studies, when other areas I did pretty well. So that's how you would read it. When the time comes and something happens in your life and you fail, just come back to me and we'll be able to dissect it together. All right, so that said, I just want to give you the quick update about hypertension guidelines and periodontal, the 2017 AAP guideline, okay? So hypertension guideline has all been updated to the new guidelines. So don't think about the old guideline anymore. And Professor Vogelheim, at the school, do you know what the school is teaching in terms of hypertension?
We're using the new guidelines for the American Heart Association as well, as they were not taught anything but the 2018 A classification.
Awesome. So that's all you have to know, that the school has perfectly just, is aligned with the NBDHE. So don't even think about what I said. You are on the right track. Now, when it comes to the AAP classification, the 2017 AAP classification, do you know what the school is teaching right now?
That's what I taught them in periodontology. They did not learn the 1999.
Okay, great. So this transition year is still a little bit of a transition year. They were supposed to update everything by 2020, maybe because of COVID, they didn't have time or they had other priorities. Right now, the current statement from the NBDHE says you kind of need to know both, which is not super helpful, but that is the current statement.
Okay.
Again, it was supposed to be completely revised this year. Right now, they're saying next year is going to be revised. So, there's not a whole lot to learn about the old guideline. What I would focus on, for example, is, let's say if you localize is 30%, there's some older terminologies like chronic periodontitis or things like that, that it has changed a little bit.
I can share that with them. I had a hunch that that was maybe going to be the case after the COVID hit, but at that point we had already had it in class and I was hoping they were moving forward. When I contacted the ADA last spring, they said that they were going to roll out the 2017, 2018. I've seen it both ways acknowledged in the fall of 2020. So I was optimistic that they weren't going to get the 1999, but it does sound like they're still maybe hanging on to a few of those exams.
Yeah, yes, I mean, I think they just didn't have time to update everything. And I think I can understand that too, just because it's been crazy. So, your professor, will cover what you need to know about the old periodontal guidelines. At StudentRDH, if you have it, if you're curious, we actually have the old and new guidelines. So we kind of blended them in right now until they are 100% confident that they will go with the new guidelines. So you have everything in StudentRDH, just in case you are wondering. Now, let's talk a little bit more now about the exam format, because it's like running a marathon. Anybody had run a marathon over here, or like anybody play sports over here? I cannot tell you that I play sports, so I won't even try to make up a sport. Anybody want to share if they play football, tennis? I guess I play a little bit of tennis. I still don't really know the rules other than just try your best. Okay, so we have Megan, sorry. Yep. Oh, I think that is how it was spelled. Perfect. Thank you, Megan. So you say you played hockey and softball. Okay. So hockey, Megan, I'm going to ask you first, how many players are there? You need to teach me A to Z in hockey right now. Hockey, how many players do we have? 5? Am I correct? It's like playing a game right now. So what I'm trying to say is 6, including the goalie. Thank you very much. Okay. And I think it's like trying to score as many as you can, but there are a lot of rules you have to follow, right? When you hit someone, I'm making this up. When something happens, or someone's injured. So you're trying to learn the rules before you play the game, right? Usually that's how it works for professional hockey. If you're just playing for fun, whatever, just go chase the puck. But here at the NBDHE, we are being professional about our examination too. So we really need to know the rules of the examination. So that's why I have here the format for you. So you understand exactly what question type you're gonna see, how many questions you're gonna see, how many minutes do you have for your break, things like that. So you are really prepared. So first of all, I have some questions from students sometimes that says, can I take the paper examination? That's 100% gone. Okay, unless you can prove that you have some sort of disability, it's all going to be on the computer, which probably is not a problem because all of you are really used to the computer now, right? So you're going to take it on the computer, and this is how many questions you're going to have. Again, I'm talking about the normal NBDHE, the long format, because right now the short format is temporary. They are going to go back to the old long format. So I'm just giving you this normal format first, and then we're going to talk about the short format. So in total, we have 350 multiple choice questions. Yes, right? This is a big yay because nobody wants any fill in the blank or any essay questions. You know, as a funny thing, just funny fact, in England, if you want to become a dental hygienist, you know, they write essays. They don't take the multiple choice exam. Isn't that crazy? They have to write pages of essay. So very different system, multiple choice, 2 sessions, session 1, session 2. The first session is more about basic science, such as oral pathology, about radiology, but not really about the clinical part, more about the science of it. So I think you can picture that in your mind. Session 2 is about case studies, and I have videos of how they roll, okay? So you have to know that there are 2 sessions separated. In between them, there is a lunch break, and I'm going to show you in one moment how it's going to be. So again, short format coming at the end. Here is actually what it looks like. 15 minutes at the very beginning, you sit down and you get a tutorial. So it's like, try to click here and you're making sure that your mouse is working. Try those 5 questions just for fun and just to make sure that you understand how the computer is programmed in our examination room, things like that. After that, you're going to have session 1. That's 200 questions, 3.5 hours. And then you're going to have a break, and then you're going to have case studies, which is session 2 for 4 hours. Now, I'm going to make it just a little bit complicated for you. I'm going to just divide it in 2. Or let me do this. So session 1 is actually session 1-1, and there's session 1-2. Session 2 will be divided into 2 again. We'll have 2-1 and 2-2. Is it clear for everybody how the exam is programmed for the whole? Okay, great. And here I'm going to add one more thing here. There's a 15-minute break in between 1-1, 1-2, another 15-minute break between 2-1 and 2-2. Those 15-minute breaks are scheduled breaks, meaning that when you're done with session 1, the countdown for 15 minutes will start. You can come back earlier. After 5 minutes, you're like, I'm ready, I'm rolling, that's fine. But this is a scheduled break versus unscheduled break is, for example, when you want to use the bathroom in like 1-2 area, you just have to raise your hand. You have to lose 3 minutes to go to the restroom and come back. Those are unscheduled break. But I just want to show you that there are scheduled breaks over here, and over here, okay? So hey, in my mind, I wish it was like 200 questions, 4 hours, 200 questions, 4 hours or something like that. But it's a very complicated format. 200 questions, 3.5 hours, 150 questions, 4 hours. But you know, at the end of the day, this is what I'm going to tell you. Everybody who has taken the National Board examination always tell me that they finish within 4 hours. There really any student who takes more than 4 hours to finish the examination. Now, what I would like to say here is, first of all, know that you have a lot of time. Do not rush. That would be my one point. If you feel like you're rushed, the average don't even use half of the time. It's like, you know, Megan is playing hockey and she doesn't even use half of her given time to try to score. So slow down. okay? If you need break, just take the full break. Don't feel like you're rushed, okay? Second, what I'm trying to say here by students are finishing way too early is by doing it too quickly, you're gonna make a lot of mistakes. Like anything in life, right? I try to write an email really quickly, I'm gonna make a lot of typos. It's okay if it's just an email, but it's not okay if it's the exam day, okay? So I just wanna mention that so you can actually think and you can actually understand that you can take your time. All right, I think I emphasized this enough. Now let's talk a little bit about question types, because in my mind, those are really, really important. We need to understand exactly what types they're gonna ask us. So this is a quick video of how it runs, and this is a video from StudentRDH because I cannot go in the NBDHE and take their screenshot, but I'm trying to show you here is that there's a timer. This is session 1, okay? And you're just gonna keep going. You're just gonna find the correct answer and keep going. And then there's a flag function. We're gonna talk about this in the very last portion of things that you didn't know. I'm showing you here already that you have a flag function. So I think you understand all what session 1 looks like, right? So now you have a bigger picture of, you know, the general idea. Now let's dive into the exam format. So there's 5 different groups of questions in general. Now, 2021 comes, I'm gonna dissect the guideline again, some things might change. Okay, so I'm gonna make another video then and telling you exactly what has changed. So this information might not 100% accurate later, but currently it is. So there's a completion type. So if you look at this, is clustered sebaceous glands observed on the buccal mucosa is, and very easy question, right? And you're just trying to fill in the blank here at the end. And what is it? Well, keyword here, buccal mucosa, and you can easily get to Fordyce granule. I hope we can all solve this, right? So that is the first type of question. The second type of question is, they call it a question. There's a question mark, something, something, question mark. In this case, it says, which type of hypersensitivity has the most delayed response? So you're looking at the body having hypersensitivity. There's some types that are delayed response, sometimes are immediate, right? Which one is delayed? So this would be, again, fitting well into session 1 because it is asking some questions about basic science or things we have to know in dental hygiene. So here, I'm gonna give you a memory tip here. I say 1 second, 2 minutes, 3 hours, 4 days. So this is just a little trick, or I do a lot of memory techniques for our students so that you can try to memorize everything, literally everything in your textbook. So this is a little thing. So 1 second versus 4 days, which one is delayed? Obviously, 4 days is delayed, right? So this is the one that when you have, for example, contact dermatitis. I once went skiing and I had a helmet, and my forehead, like the whole entire area that I was wearing a helmet, just looked red, swollen. I didn't look good. So, you know, I went to the doctor, he said, this is probably contact dermatitis. And yeah, it looked like exactly the format of my helmet. So there was some element in it that made me irritated on my skin. So that is, for example, type 4 hypersensitivity versus type 1 is like when you have a patient who is about to have an anaphylactic shock, okay? You really need to administer epinephrine right away, call an ambulance, probably have them lie on the floor because they might faint and hit their head. Any questions on this so far? You can say yes or no, and if you do, feel free to put it here again. I'm here to share everything that I know. Okay, so I'm gonna continue here. There's another type that is called the negative question. Okay, have you ever seen questions that are with except or false? Have you seen those questions in your examination? Maybe your professor gave you some questions like that, or maybe you have seen them in your textbook. All right, Stephanie says yes. Pearl says yes. Megan says yes. Okay, so those questions are called negative. So you're trying to find the one that is not correct. So those questions students find a little bit more difficult because it's conditioning. I mean, so we're conditioned to choose the one and correct answer. However, this is the opposite. So our brain needs to kind of take a moment and think about the opposite. So let's do this together. It says, the following conditions are contraindicated for nitrous oxide, except. So we're trying to find the exception. Now, this is a trick that I do, that I teach your students. When you have an except or something false question, play the true and false game. You're going to read each statement and try to see if it's true or false. Are you ready? We're going to do it together. Chronic, so COPD is a contraindication for nitrous oxide. Is it true or false? If your person has COPD, it is contraindicated for nitrous oxide. Megan, thank you for participating. That is a true. COPD is a lung disease. Their lungs are not functioning properly. Therefore, the gas exchange with nitrous oxide is not going to work properly either. Perfect. Asthma, is it a, asthma is contraindicated for nitrous oxide. True or false? Now, this one is a little difficult. Obviously, you can see the answer, but this one is false. So asthma itself is not a contraindication. Actually, patients with asthma have been sometimes benefiting from nitrous oxide. So this one is false, but let's keep looking at the other one. Cystic fibrosis is contraindicated. True or false? Cystic fibrosis is also a disease of the lung. Therefore, it is true. You do not want to give it to them. So this is a chronic disease, you know. I think this is a genetic disease. So when the asthma is, it could be chronic as well, but in most cases, you know, it's something that happens with a quick trigger. And this is what the patient has been living for many, many years. So that's the difference. And here, pregnancy is a contraindicated. True. You know, in pregnancy, obviously, we're very careful with everything. And here, one thing I would like to point at is it doesn't even say which trimester in general. And, you know, there's some trimesters that are a little better for dental treatment than others. Anyhow, I just want to show you that when you have a except question, play the true and false game. Here, there's another version that I have for something except. So let's do it together. Root planing strokes have lighter lateral pressure. True or false? Root planing is a lighter pressure. True or false? Anybody want to participate? True. Is it lighter? Okay. B, okay, so some of you are saying false. Okay, let's say B. Root planing strokes are short. Are they short? Okay. We have a true. I'm not sure if that was a true for the previous question answer choice or not, but let me just go through this, okay? Because sorry, it's a little hard to coordinate the timing. So C, root planing stroke should overlap previous stroke, and D, they should employ a lighter grasp. Okay. So we need to find one that is false. That is our game here. There are three that are true, one that is false. So let's just start with D here. You know, when you're working on the roots, it's much more fragile than the enamel, right? So you need to be light. Okay, so light is a true thing. And then you need to overlap. That's kind of the basic of our dental hygiene strokes. That's a true. And the one that is false is here. It is not short. It is longer strokes. So you can, I just want to point out that you just need to play the true and false game in this case and go find the one that is false. Again, take your time. I would rather you spend 5 minutes on this and maybe spend 1 minute on the different type of question, because this is what really students struggle with. Now, the other one that is a pair true and false, okay? So I'm not gonna read it here for you, but you can have a good understanding of what it is, right? The first statement is true or false. The second statement is true or false. That's that. And then another type that you might potentially see in the examination is cause and effect. Now, you have to know that when the NBDHE has their guideline, it says, well, this question type does not exist anymore. They don't even mention this type of, this cause and effect anymore. However, you might still see some questions that look like this. The reason is there are two. One, it takes them actually a long time to actually to update everything like we are seeing right now as well with the AAP classification. So it takes them a long time. So you might see some residual questions that existed. Second is sometimes you can think, well, maybe this is one of those questions that they are experimenting with. So a test or an experimental question that is not really going to count towards your score. But anyhow, I want you to just still consider it a real question and just do the best that you can, because again, we do not know whether the question is experimental or not. So if you see something like that, don't panic, just trying to go through it, because this question has existed until about 2 years ago. So I'm just saying that you might still see just one or two, okay? Any questions on the questions that you have seen so far? You can put it on the chat. Now, another one is the testlet. Testlet is used for community oral health. Now, community, I'm going to tell you that is really important later. But community oral health are all with this format, which is just a little scenario of what happened. In this case, it's a school nurse. They are concerned about the students' dental health, all of that. And they obviously did some measurement, the MFT. And then you have a question. According to the case, the D, indicates that. So you have to read the question, and you will have about 5 of those questions following each scenario. So they call the testlets. So if you're wondering what this means, it just means a little case scenario, but it's not a full case that you're going to see. I'm just going to show you that in 2 seconds. Any questions on community oral health testlets over here? If we are okay, I'm going to continue. Now, the big question is case studies. Case studies are pretty difficult. You're going to see chart, radiograph, photograph, and patient profile in tabs. They will be about 12 to 15 case studies, and here it is. Here is how the case study works. So you're going to click through all of those different things, and you're going to read it carefully, and you are going to, well, take the quiz. So after each case presented, you have about 10 to 15 questions that are going to follow this. All right, any questions on the format of the case study? Now, it is still pretty straightforward. You have to just really discover the charts and the radiograph and the profile and everything to be able to answer this question. My advice would be, this is what happens. This is session 2, everybody gets tired, right? So what happens is that you're gonna think, oh, I just wanna go home. Your brain is gonna start screaming at you. Your eyeballs are gonna start burning. Therefore, you just wanna get out. And you're gonna rush through the case studies. And you're gonna read your case once, and you're gonna try to actually going to solve all the 10 problems that you have by just reading the case once. I would really encourage you to just take a step back, and every time you see a question, let's say this is question number 1, you're reading the case. If you go to question number 2, don't assume that you know everything about this case. There's a little things in here that might have been really important actually. So reread the case. So my point here is with every single question, treat it like a new case. Just refresh your brain and be a detective and finding every single clue that you can. And it is time for a giveaway now. If you guys want, you can text me here at 202-410-4202 and put the word StudentRDH. It's going to ask you for your name and your email, and we're going to announce the winner right now before the end of our presentation. Okay, you can just take a quick screenshot of that, or I can put the phone number over here and just text me before you are done. We are done with the presentation. Great. So some preparation tips over here. Well, we are learning online, and I want you to get a timer for the mock exam. Now, at StudentRDH, we already have a timer. In case you are using something else, I want you to time yourself again, because I don't want you to go to the examination feeling like I'm going too slow or too fast. You have already practiced that. You know, it's like a marathon. You have already ran that once at least. So another one is students ask me, how long should I study for? I would say 3 months. That's the general average. Now, if you feel like you need more time, if your schoolwork in the last semester is like a lot, then you know you need maybe 5 months. Okay, so this really depends on the style that you have. It also happened that some students, because they were already really ready, they took StudentRDH for 1 week and they still passed, you know. But I would say just, you know, don't delay it if you can. And my promise as StudentRDH is we have a 6 month period for you to use it. However, if you're like, Claire, I'm just taking my examination in July and I need it for 10 months, that's okay. Just email me and I will extend to you until you pass. Okay, so that's my personal promise to you. And I just want to bring out that it takes about 3 months for an average student to really dive into everything. And anxiety is a big part of passing the examination. So I'm just going to tell you one trick that I have that's really easy to do. So if you are preparing for the board examination, as soon as you are getting a test center, so you have an appointment, you get the address and you're going to drive there. You're going to see how the drive is. You're going to see where the parking is. You're going to see the entrance. Actually walk through the entrance. Go up the elevator. Maybe it's COVID. They don't even have elevators anymore. They want you to take the stairs. I want you to pretend that you're going to get to the exam center. Why? Because then your brain will be able to feel comfortable. It is not the unknown anymore. So by doing this one little preparation of I've drove there, I've seen the room, your brain is a lot more ready. So as soon as you have an address, again, try to drive to the test center. And one more thing I would say when you're preparing over here, I want you to just do this. I want you to just use tomato techniques. I have some YouTube videos on that. Anybody have watched them before? So what are those? There are 30 minutes little chunks. So it's a challenge for yourself. It's like, okay, today I'm going to study radiology. Well, I'm going to use 30 minutes fully focused. I'm not going to go try to get a coffee, answer my phone, or trying to go on social media, or you know, try to be distracted. You are fully focused for 30 minutes, and then you can take a little break, and you come back feeling like you are going to focus again, and then take a little break. So this is called the Pomodoro technique. I like to call it the tomato technique just because Pomodoro is a type of tomato. Okay, it comes from the word where you have a tomato looking timer in your kitchen. I don't have those, but that's what it comes from. So just try this. The reason why I'm emphasizing this right now when you're preparing for your preparation is because your exam is going to be 8 hours. However, what's going to happen if you can't even focus for 30 minutes, right? So that's what I wanted to show you. And then now let's go to the exam day. Okay, so I already told you about the schedule over here. And I just want to point out here that you cannot bring anything, and you can request earplugs from the staff. So I would strongly recommend you to do that. They also have like earmuffs, but I found earplugs to be a little bit more comfortable. If they don't have them right there for you, request them. It won't cost you $1. It's already included in your pricing, so you don't get distracted by other people. And you will get some sort of board with a marker, like a Sharpie marker. So you can write down some things such as a hypertension guidelines, you know, some things that you really need to remember. Sorry, I'm swinging my arm just because this thing is on timer. And if I do not move, it turns off. So you will get a little board. Now you cannot erase what's on it. They will collect everything from you when you're done, but you can always ask for more little boards that are laminated. Any questions on that? And you can use the restroom anytime you want by raising your hand, even if it's an unscheduled break. And you get a lunch break between session 1 and session 2. So one question I get a lot, if I'm not done, what happens? Do I get a 0, right? Let's say you had an hour and a half for, no, actually, let's say you had 2 hours for the from 2-2 session, and time is up, you only finish, well, less than half of the questions. What happens? You get a 0? No, the computer submits whatever you have done so far. So don't freak out about that, okay? I just want you to be comfortable taking your time. All right, so this is the last part of our presentation over here is things that you may not exactly know, which is before you submit the examination, you can see a grid summary of what you have answered and have not answered. Sorry, my slides are just dancing today. So I'm going to show you this, a little grid that shows you what you have done and have not done. So this is a StudentRDH screenshot, but it would look something like that. So as StudentRDH is built in on the side, for the NBDHE, you're gonna see it at the very end. So you can see, for example, I mean, this is just a screenshot that, everything here you have not done yet. And then there's another thing I want you to know, and then there's a flag function. I talked about that, right? StudentRDH, we have it for you to practice, but when you go to the examination, there's actually a flag or star function. You can click on that for yourself to remember, hey, that question I needed to come back to because of whatever reason. And you will see it in the grid before submitting the examination. Any questions again? I just want to again try to tell you everything that I know. Community oral house is extremely important. It's about 15% of session 1. So I'm not sure if you're a big fan of community oral house. It could be a lot of gray zone, which is very difficult to answer, right? It's not always like this is the best answer, but it's a lot of critical thinking. So I just want to emphasize that you really need to know a lot about community oral house. Please take your time mastering that specific content area. And I just want to know over here, did you take community oral house yet in your school? Have you been able to take that?
Yeah, right now, Claire.
Oh, wow. Okay. If you're doing it right now, remember what I said? It's a huge part of the examination. So pay double attention to that, please. Okay.
I've told them that as well. I don't teach community, but that's my understanding as well. And
perfect.
That they need to know that topic.
Good. Well, it was perfect timing then.
Yep.
Yes. All right. Well, you will be sharing the room with other people as well in the room. That's why, again, I want you to have ear plugs if you can. Now, if I fail, I really don't want to talk about it because you're not going to fail. But just in case, so the 3 attempt went to a 5 attempt. It's flip-flopping a little bit. That's why it's a little hard to know right now. So know that you have 3 to 5 attempts. So, every year they kind of change their guideline. Know that you just have a limit and you must wait 90 days before you take the next attempt, okay? So when you fail, you just have this window period that you can't really do anything. So that was really it for StudentRDH presentation about everything you need to know about the boards. Now I'm gonna just take you out of this presentation and take you to the other presentation because I wanna talk about the short format examination. So this one, I'm gonna start again over here. Now, I'm gonna go backwards and tell you why they created a short format examination because they just wanted, the students could not schedule the 8-hour examination. That the testing centers, which is not the NBDHE, so testing centers that really couldn't fit us in. So that's why the NBDHE had to do something and say, if we cut it by half, at least more students will be able to schedule their examination. So that is what happened. And what it is that the format is the same. Nothing has changed over here. I'm going to show you. Format is the same. So you have session 1 and session 2, just like you had in the real, like the normal examination. But your time is different. So instead of 3 hours, 30 minutes, 200 questions, you have 85 questions, an hour and a half. You have the same break. Okay, so the break over here, but then you have, this is session 2. Instead of 4 hours, 150 questions, you have 1 hour, 50 minutes, 70 questions. So they cut it by even more than half. Mm-hmm. But what you have to know, again, everything that we talked about, the exam components, how the exam runs, or the question type, case study type, they're all going to be the same. So that's why I didn't spend too much time on it, because it is just really like they just chopped every portion in half kind of deal. Any questions on that?
Claire, one thing I heard is that they took obviously the hardest questions and rolled them into the shorter version. Is that something you've heard?
So thank you for bringing that up. It's hard for me to say they only took the harder questions, just because every single student gets a different set of questions.
Right.
So it's a little hard to say that. However, I'll be very honest with you, I've seen more failure rate than I did before.
That was my presumption, because I had some seniors this summer that asked me for my opinion because they had the option of doing the short, and I suggested that they stick with the long. I just felt that they had a better chance of passing with the long based on the information I had at that time.
Right, and I would agree with you, just because it's a little bit of, you know, like that right now. We are, you know, it's a little hard to understand. Is that because of the examination itself, or it's because, you know, there's a lot of anxiety that we had, you know, this year? I mean, it's all of us. So is that factor, or maybe the exam room doesn't feel as comfortable anymore? So it's a little bit more psychological. So I'm really happy you're bringing that up. You know, at the end of the day, I think the only thing we can do is just really do our best, just prepare for it as we always would. And whether it's a short format or the long examination, you know, it is the same. However, short examination, you can understand if you make a mistake, that mistake is like amplified.
Right.
Because, you know,
less questions.
So that's why it's actually even more important to prepare as well as the best we can this time. All right, so one last thing I want to say about StudentRDH is that we have actually created a new short mock version. So it's actually, I'm uploading it as we speak this weekend. That means you are going to be able to take the short format and StudentRDH. We also have the long format as well. So you will have both formats. Try both, so you just have a realistic understanding of what it feels like.
Claire, so just to clarify, they're still offering both exam formats at this time, right?
Oh, no, so sorry. I should have mentioned that. They're not offering the long examination anymore. Everybody's scheduled for the short examination.
Right now, okay. And
yeah.
I guess we'll just have to wait till the book comes out in 2021?
Exactly.
Okay, because this summer they were in transition. So like I said, right. Seniors that I was working with still had the option of the long or the short, but now they're going just to short.
Exactly. So that was in that period of time when they already kind of registered and they were waiting for a date or something Correct. Like that. Now, you know, now everybody is probably all done with that. So they're only doing the short examination to really maximize the capacity, you know, in the test center.
Okay.
Yeah, so that was it. Thank you everybody for being here. And I know I said I would do the giveaway. Are you guys ready for that? Anybody has entered? I see some here. So text. I don't know who that entered. So if you guys are ready, I'm just going to pick a winner. Okay, you can still enter as I speak right now. Otherwise, the winner will be. We have an Alyssa. Do we have an Alyssa here? If yes. You are here, Alyssa, you can either come on the microphone, you can just say, yes, all right, Alyssa, awesome. So I'm gonna make sure I send you a little email and then give you your gift card. So thank you so much everyone for participating.
Claire, can I ask a question regarding the book? I appreciate the faculty book that I got, and in the book you have included a little edit page just saying some corrections in the book. Mm-hmm. And I know this happens periodically with all reviews and things, and as far as you know, but for the most part, they're minimal things. With this would be the only thing that you know of at this time.
Correct. Okay. And thank you for bringing that up, and I will give you an update on that as well. So since you received that book, mm-hmm. we worked already on the next edition of it. We corrected those. Kind of just find, you know, some other things that we could improve on. So every 3 months, even 4 months, you know, or so, not even every year, we update it. So right now we would be even, the next set of students will get probably version 4 or 5, you probably had version 2 or 3, I think, because I sent that to you.
I'm not sure where it says that. It just,
oh, no, I don't. I actually don't put the edition number in it, but
okay.
yeah. So I know because I put a little paper in there saying those are the things that need to be corrected.
Yeah, okay. And so if the students were to sign up with StudentRDH at this time, will they get the newest book, or are they going to get this older book?
They will get the newest version. They will get whatever freshest version. So we have edition 4 right now, actually, and we corrected the things that you have seen already in the paper.
Okay, okay.
Mm-hmm.
And
yeah.
then what about, I, for some reason can't get back to my screen. Oh, there we are. And then what about the students that might have purchased the book already? They're not eligible to get the newest one? Because I have some students, I think, that just purchased from you
sure.
the last book, like within the last month.
Okay, let's do that then. For you guys, you know, if you send me an email that I'm from Fox and we had this webinar, you know, what I'm going to do is I'm just going to honor it. I'm just going to, you know, say, hey, here's the new book for you if you need it. You know, if you want it. Otherwise, if you are on the website, so if you see on our website, it is always the most updated ever because of the nature of it. So you can always compare it to the website information as well. However, if you tell me, Claire, you told me during the webinar, you're going to do this for me, you know, at no additional cost, I will honor that.
I appreciate that. And that was Claire at CLAIREJ@studentrdh.com.
Exactly.
Okay, because I do know a couple of them did purchase the book within the last month and a half.
Okay, yeah, no problem. We can always make that happen. Again, just please tell me where you're from, okay?
Yes.
I don't make this promise everywhere. Just want to make it special.
Right, right. No, I appreciate that. And then I know one student had a question. So as of right now, the only option for the exam, she said, is they no longer have the 8-hour, it's just the 4-hour option right now.
Correct.
And then I know I'll go on, would you suggest, I usually go on between December and January, I go on and I download the guide for the following year.
Right.
So have the most current information in terms of this, whether they're going to keep the short format, right?
Right. And
I
also
think they're going to, because this pandemic's not going away anytime soon.
not right now. Yeah.
Yeah. Okay. All right. Well, I thank you so much. Thank you for your time. And now next, do you suggest we schedule something with you again, or do we just assume that the updates, if they purchase your review, will be on there?
So the updates will be there. You know, we constantly work on content every single day.
Okay.
So the best way is to ask me directly at that point of time, Claire, what do you think?
Okay.
Then, yeah, I'll be able to tell you.
Okay, very good. Does anybody have any last minute questions for Claire? We certainly appreciate her time.
Mm-hmm. Well, thank you, Megan, Justine, Stephanie, everybody who has participated. You know, I know the school is working really hard as well right now. And Professor.
Yes, we really want to see them be successful. They've been through a lot, and we're trying to do whatever we can to help them out. It's exciting times to be a hygienist.
Big transition, so you're going to remember.
Yeah.
Right. Thank you again, Professor.
Have a wonderful day.
All right. Bye.
Bye. Get up!